California politicians have passed a law to fast-track the licensure of doctors who practice experimental therapies on children. I'm speaking directly to physicians, healthcare workers, moderate Democrats, independent voters. I always say that progressive isn't working, but in this case, progressive is unethical. The law in question clearly states that the medical board should expedite the licensure of physicians and other practitioners who will specifically practice gender-affirming care. Now, gender-affirming care has been proven to be not standard of care, experimental, by the rest of the world. There are zero data, and we as physicians, as healthcare workers, are encouraged to practice evidence-based medicine. Gender-affirming care is not rooted in any evidence whatsoever. It is rooted in the opinion of medical activists who think that butchering children, giving them irreversible hormone and surgical therapy is somehow a cure-all for an underlying mental disorder, which would be better served with counseling with the parents. But if you take this in conjunction with other laws that the progressives have passed, that is where the real danger lies. Proud progressive Laura Friedman and her progressive caucus recently passed a law that emancipates children as young as 12 to make their own medical decisions independent of the parents. Look at it this way. You have doctors who are practicing non-standard, non-evidence-based care who are going to be fast-tracked. And the licensure process ensures that your background is checked thoroughly. Any bad outcomes you have, any lawsuits you've had, any disciplinary actions, that is what the licensure process is meant to catch. So if they're fast-tracking doctors who are going to practice gender-affirming care, you can imagine how many substandard doctors might slip through the cracks. Pair that with prior legislation that allows a 12-year-old to emancipate his or herself from parents to make medical decisions. Again, my physician brethren and sistren, I'm talking to you. Does a 12-year-old have medical decision-making capacity, or should you run things by their parents? So if you have a doctor who's practicing not standard of care, do you trust a 12-year-old child to make the correct decision and be able to process the risks and benefits of something that is completely irreversible? We know the Cass report from the UK says that there is no evidence base. We know that the leaked WPATH files quote physicians who say, when I'm discussing future fertility with a 14-year-old, I know I'm staring at a blank wall. There has been a systematic assault on parental involvement, on parental rights. You have Laura Friedman saying exactly what she thinks about how much purview parents have over their children.
So yes, parents have some rights.
In what universe do we as physicians, do we as reasonable people think that it's okay to have doctors fast-track their licensure to practice non-evidence-based medicine, to have a child who can't comprehend complicated risk-benefit conversations to make a life-altering decision? In what universe do any of us reasonable people think that it's okay to allow this to happen? I am not okay with it. That is why I'm running for Congress. I am Alex Balekian, MD. I'm the candidate of reason and responsibility. I'm the candidate who's going to bring sanity back to this government that has been hijacked by the far-left progressives like Laura Friedman and her progressive caucus. We need to put a stop to this, and I'm going to do it. If you want to volunteer to help out our campaign by knocking on doors, if you want to contribute to our campaign to amplify our message, you can do so at alexforca30.com.